Chronic disease in children is rampant today. Chronic disease is bad, period. But in children, it hurts us worse because in children, the child wasn't allowed to live a normal life yet, whereas some adults that experience chronic disease had years where they were normal or healthy or at full potential. I want to discuss this today because today I had two child clients, one 3 years old and one 9 years old, who both have been suffering their entire lives with chronic disease. And the conventional medical system has failed them by the way that they perceive them, look at them, and treat them. Let's dive into it and talk about how conventional medicine and functional medicine are at opposite ends of the spectrum in terms of how they view the patient. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. The way that the patient is viewed by the clinician that they're working with means almost everything. For example, if you are viewed one way by conventional medicine and one way by functional medicine, one is likely to get much better results. And it's the one that views you as the person that you are, not the complaint that you walked in with. And that model is the functional medicine model. For example, the first child that I saw today was a 9-year-old boy struggling since age 4.5 with partial complex seizure disorder. This child has been through the ringer with neurologists, and he's had every test repeatedly, EEGs, like repeatedly, and they find nothing, okay? He's then been exposed to every drug on the market for, he's been on seizure drugs, but then he's been on every psychiatric drug because there's also ADHD in the picture and trouble in school from a learning perspective. So this child in the conventional model is viewed as a brain and a dysfunctional brain. Well, they've come to the point where they're basically throwing up their hands and saying, we've done everything, and that's about it. Child number 2 is a 3-year-old that's had systemic or body-wide eczema since essentially birth. And the parents were sitting in front of me today and they said, our dermatologist and our pediatrician literally threw up their hands and said, we don't have anything else. We've given you every steroid and every topical that we would give you for this child. So what does the future look like for both of these children? It doesn't look good. And if you're a parent in that situation, you're saying we've got no hope, but you don't want to give up because you're a parent and you know there's hope out there. Well, that hope is a different paradigm in terms of a clinician's approach to your child's case. And that paradigm would be functional medicine. The difference is, whereas the conventional medicine and the specialists look at your child as only a brain or only skin, functional medicine's looking at you as a human being. And yes, you walk in with a brain complaint or you walk in with a skin complaint, but in my mind, hey, that's interesting, but those complaints aren't occurring in a vacuum. They're being impacted by all the rest of the physiology going on. And so if we can get a thorough history and we can review your medical records and we can examine you, we can find the other pieces to your physiologic puzzle that may be contributing to the dysfunction in the brain or in the skin. And the brain and or the skin are an effect, not a cause. For example, in the brain case, they haven't been able to make any headway even though they've run tests and given psychiatric drugs. Okay, well then wouldn't it be smart to look elsewhere? Einstein said the definition of insanity is doing the same thing over and over and expecting a different result. Well, how many EEGs do you need to run to say, hey, it's not gonna show different this time, okay? So let's look below the brain at the rest of the body and say, is there metabolic dysfunction going on? Is there autoimmunity going on? Is there infection going on? Is there blood sugar issues or hypoxia? There could be a bunch of things that are metabolically preventing the brain from functioning optimally and setting a low threshold so that a seizure could be triggered easily. From the skin case, throw up our hands. We have no more steroids to give you. We have no more topicals. You've done them all. So that's not a good answer. A better answer would be, let's look elsewhere. Let's refer you to someone who could look deeper, etc. So maybe the skin is an effect of a cause in the gut. There's a gut-skin axis, and up to 80% of your immune system's in your gut. So if the gut's trashed, in a certain individual, that may result in skin disorders, like in this young child. So we need to investigate this child's immune system, this child's infectious status, this child's systemic inflammatory status. This child has known food allergies, multiple. Are there food sensitivities? Are there environmental sensitivities? So these are the pieces we need to put together. This is the detective work that needs to happen to really determine the cause and really change the lives of these children, not steal the hope from them and their families because we're a myopic specialist and we don't want to look elsewhere, know how to look elsewhere, or even think to look elsewhere. Let's serve the patient in front of us. And if we've done everything we know and we can't find it, then we need to get them to someone who knows more than us and make sure they get the care they need. I don't know everything. I may need to refer them. If you don't know everything, refer them to someone who knows more or knows an area that you don't, and look there. So soapbox needs to end, but if you are a parent of a child with a chronic illness and you're not getting the care or the answers or the detective work you seek, then seek out a new detective. There are many of them all over the place, and they function under the umbrella of functional medicine, because functional medicine is root cause resolution as opposed to Band-Aid symptom suppression by conventional medicine.